with mental health can be very challenging. This is more so now that the social support systems from family, the community, and religious groups are shrinking due to global economic challenges. Experts say mainstreaming mental health issues will go a long way towards mitigating the triggers of mental health challenges. They say managing stress proactively through balancing schedule is sacrosanct. Mostly because, though mental health issues can affect anyone, some professions, including journalists, who are often exposed to traumatic events and high level of stress, are more susceptible. Therefore, coping with mental health requires taking a step back. Simply put, it's okay to take a break once in a while and focus on yourself. Welcome to 30 Minutes on NTA News 24. I'm Lydia Sampson. How much attention are you paying to your mental health? How are you managing everyday stress to prevent them from mounting? Now, Abdusalam Jibril is focusing on issues that constitute mental health. His feature also identifies mental health challenges and how to cope with it. What are the risk factors? Is the present economic reality contributing? What should families and friends look out for before raising the red flag? Abdusalam, in his usual in-depth style, will bring us more.
According to the World Health Organization (WHO), 450 million people have a mental disorder and 25% of the population will suffer from mental illness at some times in their lives. The global health body, however, stressed that while mental health is an integral part of health and well-being, it is still being neglected in this part of the world. In 2019, a survey on mental health in Nigeria by African Polling Institute and EPI-Afric shows how awareness of mental health is low in the country, with most respondents being aware that they have mental health disorder, recognize it, and commonly caused by drug abuse, possession by evil spirits, and sickness of the brain, and majority of the patients are taken to a prayer house for spiritual interventions.
We do talk about, unfortunately, mad people in the street because that's what we glorify as those who have mental health conditions. As a matter of fact, that's what the research says. It says that the biggest idea of what Nigerians believe mental health conditions is people running on the street naked. It also talks about them hurting themselves or them talking themselves. That are the top three ideas of what Nigerians believe what a mental health challenge is. And this is not me saying it. There's research that talks about this from EPI-Africa and Africa Polling Institute. So they did research on what Nigerians believe a mental health illness. But that's not what a mental health illness is, though it can be one of the manifestations, unfortunately. Mental health condition is just individuals' well-being in terms of mind, body, and spirit. So when we think about it, it's not, a lot of times we think about it as something where people are caused by, but the truth is we all have states of mental health and states of mental well-being, right? Sometimes you're feeling depressed, sometimes you're feeling good. We have mood strings and things like that. So those all built into the idea of what mental health is, not just somebody who is frustrated or mad or screaming and things like that. We all have mental health conditions that we have to be aware of.
When we talk about it, especially when we like working with clients, there are two things we look at. Is it environmental? Is it genetic? So is it because of the space the person is? Is it because of where the person has come into? Or does the person have, are they born with it? Because there are some mental health challenges that are genetic. So if it's in your family, you are at risk of developing it. Not necessarily that you're going to have it. And sometimes environmental factors like stress, environmental factors like abuse, be it traumatic experiences, they could also be risk factors. This economic up and down we're experiencing, these are risk factors, losses, these are risk factors that we can go through. Life changes, the things that come with life, the stresses that come with life. These are all risk factors that can predispose us to experiencing mental health challenges. It's not always cast in stone that it's going to be a particular way, but that's identifying for the individual when it happens, what created this, what is the problem with that.
In Nigerian context, most of these challenges or the things we find outside, we assume they are witchcrafts. We assume that it's at the list of their laziness. We assume it's at the result of their negligence to the society, to what they're doing, but it's not. Mental health is a dangerous disease that need the critical attention for better management. And if managed properly, definitely the society will be free of such illness. Mental issues are more or less a disorder to a normal brain thinking human being to function. And at result, it could affect the feeling and the thinking and behavior of an average human being. I think in Nigeria, I think bring it down to Nigerian context. See, some people, most of the challenges they face does not even need physical physician to treat. What he needs is just one or two things to get them right.
Nigeria, with over 200 million people, have fewer than 300 psychiatrists, accounting for a ratio of about 700,000 of the population per psychiatrist, most of whom are urban-based, and in view of poor knowledge of mental disorders at the primary healthcare level, caring for people with mental illness is typically left to family members.
The number of time you spend in the office is even higher than the time the doctor have for you. But you don't blame them because they're overwhelmed. So they had the time. I think we use this opportunity to call on the government to please sincerely see how we can quickly have a quick intervention. Most of the hospital in the FCT, I went to hospital recently. Almost the whole day I couldn't even come to the hospital. Just to call my director, say, oh, see you, I'm in the hospital. But you're supposed to be. Even your phone call should give you what you want in health-wise. These things need to be taken care of. And possibly, I know the government of the day, I think with what we are seeing now, I think they are really prepared for the job.
Stigmatization, lack of mental health financing, workforce policy legislation, among others, have been identified as challenges those suffering mental health issues face.
One of the things about mental health is that if you have to look at it from back days, the language around it, how we even depict it in the movies, how we talk about it, even in the media, has always been negative. So a lot of people, that's what we've grown up with, and that's almost like a knowledge that is passed down. This family, no, we don't go there because of this. Oh no, we don't talk to these people because of A, B, C, and D. All those things are born around fear of the unknown. Sometimes what we don't know, there's a lot of conversation. Oh, it's been cursed. If you have a mental health challenge, you're cursed. But we know that that's not true. Anybody can have a mental health challenge. I think that's the thing about it. It's not a respecter of gender, social class, financial status, nothing. Anybody can develop it. Life is like life is full of ups and downs. Anything can happen, and someone can have a mental health challenge, and someone can have a breakdown, and someone can experience a mental health challenge. So I think the more we have the conversation about mental health and the better we understand it, and we know it's a health challenge. The same way you can have a headache, the same way you can develop any health challenge, you can develop a mental health challenge. Are there some people that are at more risk? Yes. There are people that are at more risk, just like every other thing in life.
I would say that there's three kind of categories of risk. One, you can talk about biological and psychosocial factors. So those are things like emotional regulation, things like substance abuse, things like genetics can cause issues or challenges or any constraints or confines when it comes to mental health conditions. So that deals with your relationships with others and things like that. Your family history can be one of the risk factors. The second is more structural. So those are things like environmental, geographic, economic risk factors. So things like poverty, things like violence, humanitarian challenges, and things like that can also be another subset of risk factors for individuals. And the third, I would say, would have to do with kind of like developmental processes. So based on people's developmental kind of categorization and growth, they can face different challenges.
We look at the environment we live. It's very, very important. Let's look at the physical health. Physical health is very important too. The physical health, it is for us to be able to mitigate what likely may increase the spread of this. We look at the physical health of our individuals. Number one, You look at the level of your exercise is very important. You look at your whatever you feel the exercise, and when you're doing the exercise, you monitor. You need an expert again to put you right on the nature of exercise that will not affect your health again. That's why you need to be guided. So there's what you call a nutritional intervention. What we eat could mitigate it. If you are not eating well, you get what you want. It's very important. That's where the nutrition intervention comes. There should be a guidance on what we need that will keep our mental health alert, because there is mental health well-being and mental health menace.
According to several reports, certain occupations or professions are predisposed to mental health issues due to the nature of the job. Some of these researchers state that journalists, military personnel, and healthcare workers, among others, can face unique risks and challenges to their mental health.
I have worked with a lot of journalists and I understand the nature of the work. I keep on saying it. Journalists are one of those frontline responders who bring the news to the world. Journalists are in a position where they are constantly coming face to face with the bad. So that is almost all the information you absorb, and you filter a lot of things for us. Even when you even when you give the information, there's a lot that is filtered for us. In the line of your work, you're exposed to news that is very scary. To be honest, you're exposed to news that is frightening, and this is first-hand response. And sometimes in your line of work, also, you can be in danger. Your schedules, for a lot of people, it's very hard. You're back to back to back working. The routines are different for so many people. So your line of work definitely can be a place where you can have a breakdown, a mental health breakdown, because of the nature of the work you do. And so that's why when people are in that space, we always advocate for self-care, because we know healthcare workers, we always advocate for self-care. People in the humanitarian space, people in the development space, we always advocate for self-care, because you are in the front line, you are getting the shock. And sometimes in your line of work, you're threatened. So self-care, especially for people who are in those spaces, because your line of work can predispose you to developing a mental health challenge.
Experts urge urgent need for concerted efforts between the government, policymakers, and international organizations to provide better, accessible, and affordable mental health services for the mental well-being of the populace in promoting mental health care and services. They also maintain that there is need for more awareness, prompting the National Orientation Agency to collaborate with the Federal Ministry of Health to create more strategic communication and coordinate the public education and awareness campaigns on mental health and mental disorders, especially within educational institutions, communities.
The next report by Thomas Obetere is providing suggestions on how to mitigate identified challenges that may increase mental illness. Thomas also looked into the importance of seeking help from mental health professionals, avoiding self-diagnosis and medication, as well as the significance of engaging in activities like exercise, meditation, and spending time with loved ones. Research shows that admitting that one is struggling with mental health issue does not make the person any less of a person. In fact, ignoring mental health issues may actually make a person less effective and more vulnerable.
Mental health issues are prevalent globally. In Nigeria, for instance, due to the alarming increase of mental health challenges, experts urge that it should be a public health concern taken more seriously, both by the government, individuals, and society. Unfortunately, most people pay great attention to their physical health challenges, neglecting their mental well-being, a situation described by experts as dangerous, while calling for urgent action from government, non-governmental organizations, policymakers, and legislators to prioritize and implement good health care, deepen accessible and affordable mental health services. This, they noted, will ensure the mental well-being of the populace. They are emphatic that there is urgent need for all stakeholders to make deliberate efforts to mitigate challenges and hurdles that may increase mental illness.
Mental health, physical health, social health, they are interwoven, interconnected, and they affect one another. So if we want to mitigate mental health issues, one thing we can do is address social issues, address physical health issues before we then focus on mental health alone. So we can't take mental health in isolation. For instance, if I'm told I have cancer and I will die in 6 months, you don't expect that I'll be happy and I'll go and celebrate.
There are just some challenges that are a part of everyday life. So we have ups and downs in our everyday lives, but it's also very important to be intentional about your mental well-being and your mental health. And that's why we talk about catering to your mental health and just taking steps every day that you can, practical steps that you can to be able to boost your mental well-being. So we have certain challenges that could be external factors, like sometimes you may think about some people go through unemployment, the loss of a loved one. There are things that you may not be able to control that could actually be a threat or a determinant factor of your mental well-being. But when you're able to take steps every day to be intentional about your mental health and your well-being, then you can mitigate those challenges.
So first thing, everybody needs to know that mental health is not a condition. Mental health is not a problem. We all as humans have mental health. We're just somewhere part-time. And it is our responsibility to take care of our mental health. So if you can take care of your physical health, you can go to the hospital. You need to take care of your mental health. And education is a big deal. We need to be aware. We need to teach ourselves.
They reiterate the need to always seek professional help and advice rather than resorting to self-diagnosis and medications. They also added that spending quality times with loved ones and avoiding acts that are capable of triggering mental health issues will be very helpful.
Then the other component is early identification and treatment. So if you see that someone, a friend, a colleague, a family member is having problems with their emotional well-being or their mental health, please do not hesitate to encourage them on time to go for treatment. So timely, early identification and treatment goes a long way to prevent the situation from worsening.
There are people who are actually trained to be able to handle these mental health challenges. It also makes you understand that you're not alone and other people might be going through the same mental health challenges, and these people who have been trained to be able to cater to this, bring solutions, help you cope, and just even teach you new ways that you could live. They are also very trained. So it's very important to seek professional help. And also mental health professionals and practitioners, they are trained to confidentiality, so you know that whatever it is that you're discussing with them is confidential, so they're not going to share it with.
It's important. I like to use examples. Let's say you have a wall to break, you want to break a wall, and all you have is a spoon. It's impossible for you to break that wall with a spoon. But when you meet a therapist, a certified therapist, a psychiatrist, a psychologist to help you, that therapist you're now meeting, the professional help you're seeking, has the hammer, has the tractor that they will use. They have all the equipment they will use and help you break that wall. So with your spoon alone, you can't break that wall. But when you ask for help, you're able to do it.
Incorporating healthy activities into one's routine to improve mental health can help people pull out of depression.
Exercise, yoga, meditation, social support, they are all social interventions that help to promote our emotional well-being. So when you exercise regularly, it doesn't mean going to the gym. You can just take a stroll, brisk walking for 30 minutes, but let it be consistent, at least 4 to 5 times every week. So when you do that consistently, what happens is that your muscles will release some feel-good chemicals in your body that will lift your mood, make you feel better, and so on. That is not just all. When you exercise regularly, your muscles will be tired, so they will also help you fall asleep better.
Exercise is good because it helps you release emotions. It helps you see it better, depending on what you're doing, and it's a release of energy. So exercises, you cannot overemphasize it, but now what kind of exercise can you do? What works for me might not work for you. Personally, I might like dancing. You might not like dancing. You might like to do cardio. I might not like to do cardio. So understanding yourself What works for you?
Doing exercises, spending time with loved ones, if you can, do meditation where you just quiet yourself, breathing exercises. These are things that are self-care. Self-care doesn't always have to be, going to a massage parlor to get, a massage, or you say you want to go and do spa. Sometimes it could just be sitting down with yourself and observing quiet time, whether it's for 10 minutes and just reflecting. Some people who are also believers, they use this time to maybe pray.
While also reiterating that there is no need for anyone to suffer in silence. They are optimistic that asking family, friends, or local support services for help when one begins to feel overwhelmed in tackling mental health challenges. Experts also noted that staying away from drugs and substance abuse are necessary ingredients that will save people from being depressed and gradually being addicted.
Social support is very critical. When you have good social support, you have a network of people around you, your family, your friends, colleagues, neighbors, people who love you and care for you and are always there, they have your back. When you have that support system, it improves your emotional well-being, makes you feel that you're not alone. You have people around you who care for you, and that is very helpful. We are naturally created as social animals. We are not meant to live in isolation.
But if you have a family member who you know has the capacity, who has this, it's better you talk to your family member, because that person is going to see you from a place of love and empathy than just a stranger. Do you understand? So yes, it's good to talk, but who are you talking to?
Say in a case of substance abuse that induces other mental disorders like depression, schizophrenia, and the rest, we can create awareness and tell people these are the causes, so that you can try to avoid practicing such habits or behavior.
From work, workplace bullying, and stress. Therefore, taking a break from work when needed, be it an annual leave or just 5 minutes break, they believe can make a difference between feeling stressed and coping with stress.
First of all, starts with job insatisfaction, people not being remunerated well, people being bullied at work, people being seen as not worthy enough. And once someone goes to work and you don't feel satisfied, you start to lose self-esteem. You're not as productive as you can. And these things many times start from the up to bottom. So the lower you go on the hierarchy, the worse you feel, because you don't have job satisfaction. And people don't respect other people in the workplace. So because of the hierarchy state, it already builds a power imbalance. And when there's power imbalance, many people don't even see that their voices are heard. They don't feel like they are contributing. That way you don't feel like part of the system. It reduces your self-esteem. It makes you feel less of yourself. And you are not happy where you are. And unhappiness is a major contributor to a bad mental health.
Please do not ignore your mental health. Once you see your warning signs that something is off, please try to get help. Try to do those activities that could help with, like activities that like mindfulness activities like meditation. Try to do more of your hobbies. Rest. Please, everybody in this country needs rest. Very important, rest.
Experts also noted that sudden withdrawals from the normal daily routine of a person, refusal to eat, unproductive ventures, and sleeplessness, as well as unnecessary stress, among others, are initial indications and signs of mental illness to look out for and must be taken seriously to avoid escalating mental issues.
It's very, very dangerous to just ignore your mental health, especially when you are going through mental health challenges. So if you've been stressed out or you're burned out, or you find that the pattern of how you're now living leans towards like maybe you might be depressed, you've isolated yourself from your family and your loved ones, or you're going through so much that you know that you've not even been, as productive as you would normally be. So you know that you're having a mental strain or a mental health challenge. It's very, very dangerous to just ignore it and to keep on moving, because a time may come where you can just explode or implode, and you implode on the wrong people.
The consensus is that more awareness creation, advocacy and education on mental health, and the fact that anyone can be affected. Therefore, mitigating discrimination and stereotype of persons battling with mental health, and how best to embrace and show love rather than judging mental health patients, will boost the confidence of persons with mental disorders, knowing that they are not alone. A multi-sectoral stakeholders approach, cutting across government at all levels, as well as non-governmental organizations and the media, must collaborate to ensuring that the message gets to the grassroots.
Thank you, Thomas Egbetere, for that. Experts reiterate that building resilience through techniques like positive self-talking, setting boundaries, socializing, taking a break when needed, as well as sharing bottled up emotions and anxieties with a trusted someone can help build resilience and cope with stress. It is important to remember that mental health issues are common and seeking help is a sign of strength. Do not suffer in silence. Please take advantage of mental health resources available near you. I say again, it is important to take care of yourself and seek help when you need it. Thanks for watching. I'm Lydia Samson. Stay safe.